Ordinance number 0-2007-97, an ordinance establishing a procedure for and authorizing a contract between the City and Butler County Community Health Consortium for the sale of city-owned property and declaring an emergency.
So moved for adoption.
Second.
We talked about this briefly in the work session. This is the transfer of the property at 930 Ninth Avenue, and we started talking about this in some detail, and then we decided we'd better just transfer that discussion down here. And Mr. Mulligan, I believe you had a question we hadn't answered fairly.
Yeah, I just want to get a clarification regarding, you mentioned one of the, I guess, additions they're looking for is the ability to mortgage that property, and we are looking to lease it to them or outright sell it, but with the contingency that we receive it back if it
because
if they
it is
dispose of it.
Because it is CDBG property, as long as it is used for a CBDG purpose, and that's community development block grant for people at home, because we talk in foreign language occasionally. So that's what that is. That's a federal program that is for certain types of purposes. As long as it's used for that purpose, it's fine. If they at some point would stop using it for that purpose, we then either need the property back or we need the value of the property back so that we can convert it into program income. The problem that is created here is part of the reason they want to own the property is so they can use it to leverage additional dollars to do improvements to the property and potentially expand the property. Now, something I didn't say upstairs about this mortgage money is that mortgage money would only be allowed to be used to improve the building and the parking lot. So they could not borrow money for operations. They could not borrow money to invest in the center in Hamilton. The money would have to go back into this capital so that the building was being improved. Now, that still creates liability for the city that we don't have now. If they don't pay that mortgage off, and we would end up stuck with it.
If they walk away from that, where does that leave us? That's my question.
But we get the building back also with the mortgage. So we have something of value that offsets the mortgage, because the mortgage would not be allowed to exceed the fair market value of the building. That's the issue there. There are some other changes there requesting that are slightly different from the version you have. Some more flexibility in assigning, because part of their dental operation is already assigned. They need that. They would like more time for the reverter to kick in if the catastrophic event is a fire or tornado or some other force of nature. And they'd like to be able to say at any time they can give us the fair market value and the reverter issue goes away, which I actually think is probably to our advantage that can occur anytime. The way the contract's set up right now is if and when they were going to get rid of the building, they would either have to give the building back to us or they would have to pay us the fair market value of the building.
Mr. Langdon, how long this has been going on for, what, approximately 10 years?
Yep.
Correct?
The negotiations to move the property, the discussions about moving the property from the city to the consortium probably started, only Laura and David probably remember those, but it's probably been 7 or 8 years ago that those started.
Okay, my question is this, and I appreciate what Mayor-elect Mulligan has brought up. I mean, one is to our advantage. I'm not following this mortgage thing. I mean, why would we do something like that? I don't know what, if they defaulted or if they done something else, I mean, what are we going to do with it? I mean, we're trying to get rid of it.
Right,
and we would trying to get rid of it.
We would, at that point, if they had mortgaged it, I would anticipate that we would attempt to sell the building or lease the building in order to pay the mortgage cost.
I don't see where that's.
Well, let me ask. I was going to jump in that question also. Can't we restrict the amount of the mortgage that they're going to draw off the building just to cover the improvements? Because I don't think they're going to need the whole whatever the building's worth. So you could probably get about 75%. from a commercial lender, but still, I don't think they're going to need that much money to do the improvements. So can't we restrict only what they're going to mortgage the building for, what the improvements are going to cost?
I think the problem is I'm not sure they know right now what the improvements are going to cost. They're also talking about expansion, potentially, et cetera.
At that location?
Yes. Now, I'm not sure, looking at the site map, exactly where they would expand to, because there's not a lot of room there.
Yeah.
I think the issue becomes here, this is an issue they have put in front of us, and that's why we're bringing it to you, is to see how you want us to handle this. There is a desire, and has been a desire on the part of the city for some period of time, to get out of the real estate business with this building and to allow the consortium continue to do the good work in the community that they do, providing health care to a population that has trouble frequently finding health care. So there's always been this desire. What they're proposing is that they would be able to mortgage the property. If we got the property back, the mortgage would be no greater than the fair market value of the property. So we would be getting back a mortgaged property, but if we gave the property away completely now, we're giving it away for $1, so there's no net loss to us in their mind. Now, but from our perspective, there certainly is a liability that gets created that the city has. Now, we have an asset to go with it, but there is a liability that's created. If you want an additional limitation on that mortgage, we can certainly tell them that. We can certainly look at this. We're trying to get a sense from them what they needed, because they have a board meeting tomorrow. We need to have a good idea of what we're willing to do. If we want to put a cap on that and say that the mortgage can't be in excess of $100,000 or $150,000, I think that's certainly within our ability to do. I mean, nobody's holding a gun to our head to transfer this property.
Mr. Landon,
this is as close as we've gotten in 7 years. I can't say that.
Mr. Landon, I agree with what you're saying. We do have an obligation to our city and our citizens, but we need to wash our hands of this. I mean, if they want the building, we don't need a bunch of strings attached. I mean, that's me speaking. I don't know how everybody else is feeling here about it, but it's gotten to the point where it just can't keep going on year after year after year.
If they take a mortgage on the building, shouldn't they just take ownership?
Again, they'll take ownership, they'll get the mortgage. The problem is what happens if the reverter kicks in. As long as the reverter doesn't kick in, there's no issue with the mortgage, because it's not our problem, we don't have to sign it.
Okay.
However, if the reverter kicks in, we get the property back. Well, with the property comes whatever baggage is then hanging on it, and the baggage that's hanging on it is that mortgage. And I don't know that anybody would lend them money on the condition that if they have to revert the building to us, the mortgage disappears. Their ability to borrow money is probably gone at that point.
You cannot make a clean sale.
Well, I think we could, but
again, because of the CDBG problem, no, we can't.
Right.
Only if they're willing to pay us the fair market value of the building.
And we've established that at 300 and some thousand or something.
The auditor has it valued at $386,550. We're having it appraised right now. Okay. We're having an appraisal done to see what an appraiser not collecting taxes on it would appraise it at. And so we want to see if that number is real, or if it's high, or if it's low. And as soon as we get that number, that will be negotiated with the consortium as the fair market value number. The problem is they don't have the ability to pay that kind of money at this point. Our problem is we let go of that, and in 2 years they decide they don't want to operate a health center there anymore, and they want to use it as a disco bar we got a problem.
Right.
Because we got a piece of CDBG property that's being used for a non-CDBG purpose, and we neither have the property nor the income from the property to show the federal government that we have handled their money responsibly. That's the problem here.
We keep saying the city has this responsibility. Are we actually more accurate saying CDBG has this responsibility? If it reverts back to CDBG. In the event that there's a mortgage, does that fall back on CDBG?
I think it actually reverts back to us because the CDBG funds are ours to expend.
Yeah.
I don't think the federal government gets it.
Yeah, well, I would imagine they'd want their money back or their property back is what it comes down to. And I'm worried about encumbering this property with a mortgage of whatever it might be.
My understanding is generally they don't even want the property or the money back. They just want to make sure we have it.
Well, okay.
Right, Marty?
Well, how about this? Since there are the strings attached and there's that reverter that we have to have in place, they get a bid on the work they want to do, and then we go ahead and approve that's work that needs to be done. We know there's work that needs to be done to the building, but it's going to be a lot less than 75% of whatever the appraised value is going to be. But let's determine what that value is that they're going to use specifically for the building, and then we sign off on it, because it's going to be a lot less than what the appraised value is,
Right.
obviously. Well, and then if it does revert back, at least we're not saddled with a large mortgage.
Well, and would we have the ability to lend the money for the improvements out of a fund or not for that? I mean, I think we'd have a little better control if we were the mortgagor on this too. I don't know. I mean,
I'd have to defer to Marty on that because I'm not sure.
Because I can see where a bank would say, well, they're taking the property in foreclosure, and we're left holding the bag and owing
exactly
the fund $300,000 for the property that we don't own or can't use. So that's where it gets to be a little ugly. So,
in terms of the eligibility, we could loan money, and we have put a considerable amount of money into that building as long as it's used for CDBG purposes. I think what we are attempting to accomplish here, though, is to try to get out of that real estate management and financing. Although at least if it's a mortgage, there's a payback provision associated with that, and we can be the beneficiary of it. But if the funds are available in CDBG, it's certainly an eligible expense.
Well, Mr. Meyer, where do you draw the line on the improvements? I mean, you could put $250,000 like that in the place.
I agree. We have to sign off on it, is what I'm saying.
I mean,
well, the mortgage issue has certainly complicated this whole thing.
Absolutely. Absolutely.
And I'm not sure we can resolve it at this point.
Right.
I'm pretty certain that the new council will have to do this.
I second that.
Let me suggest this. We're going to be talking to the Consortium's financial and legal folks tomorrow morning because they have a meeting tomorrow. I think what we can tell them is that we are uncomfortable being saddled with a potential mortgage, that we don't get to make the determination in terms of the amount of it and whether it should be given or not. And so we're probably back in a boat where any mortgage they want, we would have to consent to. Is that reasonable?
I'd feel better about it.
Yeah, just to have some control over it, I think, is where.
Not sure how the bank's going to look at it, though.
Well, yeah, I mean that's separate. That's a question for them, I guess. But
okay, yeah, that's fine.
Well, at this point, then I would remove my motion for adoption.
Yeah, I would suggest we just table that item of legislation until we've got the contract, gotten this issue resolved completely.
Do we need to vote to clear Tony's motion from the floor?
I don't think we have to move to remove it because the person who makes the motion can always remove it from the floor. As long as whoever seconded it doesn't have a problem with that.
No problem.
Who seconded?
Larry seconded.
No problem.
The mayor has not called.